Welcome to the Omni Dental Podcast.
Thanks. It's really great to be here today.
Usually when we start these deep dives, I'm buzzing with excitement because we're about to uncover something totally new, like the secret life of fungi or the economics of space travel. And today, well, I have to be completely honest with you. When I saw the topic, my first instinct was to just run.
Let me guess. The D word.
The D word. Dentistry. And not just general dentistry, but specifically the two words that I think are universally recognized as the punchline to every bad joke about pain: root canal.
Ah, yes. The dreaded root canal. It is basically the boogeyman of medical procedures.
It really is. I mean, it's got a terrible PR problem. If you tell someone you're getting a root canal, they look at you like you're going off to war or something. But here's the thing, and this is exactly why I love doing this show. After reading through the source material from Omni Dental and MedSpa, my perspective has actually completely shifted. Yeah. I'm not saying I'm excited to jump in the dentist chair tomorrow, but the narrative in my head has changed from this horror story to, well, almost a rescue mission.
That is exactly the right framework. And frankly, that is the mission of this deep dive today. We are looking at sources provided by Omni Dental, specifically focusing on their practice philosophy over in Arlington Heights, Illinois. We're going to dissect their guide on the top signs you need a root canal. And the goal here isn't to scare anyone. It's actually the exact opposite. It's about awareness.
Right. It's about decoding what your body is trying to scream at you before it's too late.
Precisely. Because the real tragedy of most root canals isn't the procedure itself. It's that people wait way too long to get them. If you can spot the warning signs early, you aren't just saving yourself a lot of pain, you are saving the tooth.
So let's get into the nitty-gritty of this. Before we talk about the specific signs, the throbbing, the swelling, all that fun stuff, we really need to set the stage. Physically, what is actually going on? Because I think most of us, myself included, tend to think of our teeth as these solid, inanimate rocks in our mouth.
That is probably the most common misconception out there. We treat them like tools, like these ceramic hammers that just chew our food. But the source material from Omni Dental makes it very clear that a tooth is actually an organ.
An organ? Like a kidney or a liver?
Absolutely.
Mm-hmm.
I mean, it has a blood supply, it has a nervous system, and has a very distinct anatomy. To understand why you need a root canal in the first place, you have to look past that hard white enamel shell on the outside. Inside, deep down, there is something called a pulp chamber.
The pulp?
Yes, the pulp. This is the soft inner core containing all the nerves and blood vessels. It is essentially the life force of the tooth.
Okay, so we have this living, sensitive core wrapped up in a hard shell.
And that structure right there is exactly why toothaches are so excruciating. Think of it kind of like a pressure cooker. When bacteria breach that outer fortress, maybe through a deep cavity or a random crack, they invade that soft pulp.
And then the body reacts with inflammation, right?
Right. But here is the massive problem with that. If you sprain your ankle, it swells up. The skin stretches to accommodate the swelling. But the pulp is trapped inside hard, unforgiving enamel. It literally cannot expand. So when it gets inflamed, the pressure builds up immensely inside that confined tiny space.
Oh, wow, that makes so much sense. That's why it's that rhythmic pounding sort of pain. It's literally hydraulic pressure pressing on a raw nerve with nowhere to go.
Exactly. It is a physics problem just as much as a biology problem. And once those bacteria are in there, touching those nerves and blood vessels, you are officially on a clock. You are looking at infection, abscesses, and if you just ignore it, the eventual death of the tooth.
See, that was the aha moment for me when I was reading this. We always think about going to the dentist to stop the pain, but the guide makes it so clear. Recognizing these symptoms isn't just about pain relief, it's really about conservation.
A root canal is fundamentally a conservation effort. You are trying to keep a vital part of your body right where it belongs.
So let's help the listener play detective for a minute. We know the mechanism now, that pressure cooker effect, but the body rarely goes from totally fine to pure agony instantly. It usually sends out smoke signals first, right?
It does. And the Omni Dental Guide identifies 4 specific distress signals that you should be looking out for.
Let's start with the big one, the one we've probably all dread the most.
Hmm?
Sign number 1, persistent tooth pain.
This is the most common symptom, obviously. But what's really fascinating in the text is the nuance they provide. It's not just a general ouch. The guide describes different flavors of pain, if you will.
Yeah, they mention it can be sharp, like a sudden zap, but it can also be a dull ache or that throbbing we just talked about.
Right. And that throbbing sensation is often the key indicator of that internal pressure building up. The source also notes that this pain often worsens when you are chewing or applying any sort of pressure. So if you bite down on a sandwich and get a very sharp reminder that your tooth exists, that is a major red flag.
There was one detail here that I found really unnerving, though, and I had no idea this was even possible. The concept of radiating pain.
Yes, this is crucial because it frequently leads to misdiagnosis by the patient themselves. The pain isn't always polite enough to stay right where the actual problem is. It can travel.
The guide says it can move to your jaw or even up into your ear.
Referred pain is incredibly common with dental infections. You might be sitting on your couch, rubbing your ear or clutching your jawbone, completely convinced you have a bad ear infection or TMJ, but the actual source is a dying nerve in a lower molar.
That is just wild to me. So you could have a splitting earache and the culprit is actually a tooth.
Exactly. And that's why the word persistent is the key word here. If you have pain in that general region, jaw, ear, cheek, that just won't quit, it's a sign the nerves are signaling deep distress.
Okay, moving on to sign number 2. And this is the one that hits a little close to home for me because I generally have sensitive teeth. Sensitivity to hot and cold.
Sure, very common.
We've all been there, right?
Yeah.
You take a sip of hot coffee and suddenly it feels like lightning struck your jaw. And you do that weird thing where you tilt your head to keep the liquid away from that one side of your mouth, just pretending everything is totally fine.
Oh, we have all done the head tilt. It's a classic move.
So how do we tell the difference between, oh, I just have sensitive teeth and I need a root canal immediately? Because I don't want to run to the dentist every single time I try to eat ice cream.
The expert advice from Omni Dental clarifies this perfectly. It comes down to what we might call the linger factor.
The linger factor.
Yeah.
Okay.
If you drink hot coffee or eat cold ice cream and you feel a sharp zap that goes away almost immediately, like as soon as you swallow, that is usually just dentin hypersensitivity. It's annoying, sure, but it's not necessarily an emergency.
Okay, so a quick zap is okay-ish. We can live with that.
But the warning sign, the real red alert, is sensitivity that lingers long after the hot or cold source is actually gone. We're talking 10 seconds, 30 seconds, maybe even minutes.
So the coffee's gone, you've swallowed it, you're back to talking to your friend, but the tooth is still literally screaming at you.
Exactly. That implies that the nerves and blood vessels inside are highly inflamed and are struggling to recover from the stimulus. They aren't just reacting, they are fundamentally damaged. If that sensitivity lingers, it is a very strong signal that the pulp is infected.
That's a really helpful metric for people. Just count the seconds. Okay, let's look at sign number 3. This one moves from feeling something to actually seeing something. Swollen or tender gums.
This is where the infection starts to make itself visible on the outside of the tooth structure. The guide tells us to look for physical changes in the gums near a specific localized tooth.
And what exactly are we looking for? Just general redness?
It can definitely be puffiness or soreness, yes.
Yeah.
But the guide mentions something very specific to look out for. A small bump on the gums.
Like a blister or something.
It often looks exactly like a small pimple on the gum tissue. In dentistry, this is often called a fistula. It's a physical sign that the infection inside the tooth has built up so much pressure that it has literally drilled a microscopic tunnel through the bone and is trying to drain out into your mouth.
Oh, wow. That sounds incredibly unpleasant.
It is the body's desperate attempt to vent the pressure. But if you see that bump, it means the infection is active, aggressive, and expanding. It requires quick care because you really do not want that bacteria spreading further into the jawbone or the surrounding tissues.
Right, because at that point, it's not just contained in that little enamel fortress anymore. It's breaking out.
Exactly. It's on the move.
Okay, sign number 4. This was honestly the most surprising one to me because I don't think I've ever noticed this on anyone in real life. Discoloration of the tooth.
Yes, this is a very specific, undeniable visual cue.
The guide says the tooth can actually turn gray or darker than the surrounding teeth. That sounds incredibly ominous, like a ghost tooth.
It is pretty ominous. The best way to think of it is like a bruise. If you hit your arm hard on a table, it turns purple because of the bleeding happening under the skin, right?
Right.
Well, when the inner tissue of a tooth, that pulp we keep talking about, is damaged or actively dying, the breakdown of those blood cells inside can actually stain the tooth structure from the inside out.
So no amount of whitening strips or special toothpaste is going to fix that?
No, because it's not a surface stain from drinking too much coffee or red wine. It's internal. And the expert commentary from the source mentions that cracked or chipped teeth can very often be the gateway for this happening. A small crack lets the bacteria in, the nerve slowly dies off, and over time, the entire tooth turns that distinct dull gray color.
It's amazing how the body signals these things if you just know what to look for. But let's play devil's advocate here for a second. Let's say I'm listening to this right now, and I'm mentally ticking these boxes. I have the lingering sensitivity, or maybe I've noticed that gray tooth. I'm panicked.
Try not to panic.
But I am panicked, because in my head, root canal implies someone digging a tunnel to China straight through my jawbone. I want to believe the rescue mission narrative you brought up earlier, but does the source material actually address the procedure itself to calm people down?
It does, and it really demystifies the whole thing. If we break it down based on the text, it's not a torture session, it's really just a specialized cleaning session.
Okay, walk us through it. What is actually happening when you're in the chair?
Step 1. The dentist simply removes the infected tissue, that inner area, the pulp chamber we talked about. They access it and carefully remove the dying nerve and the bacteria.
So they are literally taking out the source of the pain.
Correct. Step 2 is the critical part. The inner chamber is thoroughly cleaned. And I don't just mean a quick rinse. It has to be completely sterilized. They have to navigate all those tiny curved canals inside the root of the tooth.
This is where the skill of the dentist really matters, I'd imagine.
Absolutely. If they miss even a microscopic pocket of bacteria, the infection just returns later. That's why precision is so incredibly important during this step. And finally, step 3. The newly cleaned space is sealed.
Sealed up like a normal filling.
Kind of, but much more comprehensive. They use a biocompatible material to fill that empty space hermetically, so nothing can ever get back in there to cause trouble again. Then, usually, a crown is placed on top of the tooth to restore its structural strength.
And does it actually last? Or is this procedure just kind of kicking the can down the road for a few years?
The source is very encouraging on this point. It states that with proper care, the treated tooth can last for many years, often for a lifetime. It functions just like all your other natural teeth. You can chew on it, brush it, floss it normally.
I think that's the part people always forget. They think getting a root canal is the end of the tooth's life, but it's actually giving it a second lease on life.
It really is. And while prevention is obviously better, checking for cracks, brushing well, getting those regular checkups, sometimes deep decay or physical trauma just makes this necessary. And when it is necessary, it's a highly effective solution.
So we know what needs to be done. The other half of the battle, and honestly the harder half for a lot of people, is knowing who to actually trust to do it. Because if someone is navigating microscopic canals inside my head, I want to know for a fact they are precise.
Absolutely. And this entire deep dive today is based on the expertise of OmniDental and MedSpa over in Arlington Heights.
Right. And leading the charge there is Dr. Bylis Poles.
Yes. Dr. Poles has more than a decade of experience in the field. The source highlights his background specifically in treating dental injuries and emergencies, as well as general and cosmetic dentistry.
I really like the description of his approach in their About Us section. It described him as friendly, precise, and productive.
That word productive is really interesting in this context, isn't it?
It is. Productive is a great word to hear about a dentist. To me, it says, we aren't going to waste your time. I want to get in, get the painful problem solved efficiently, and get back to my normal life.
And precise is the word that really stuck out to me. When you are dealing with tiny nerve endings and root canals, precision is quite literally the difference between success and failure.
True. Now, for our listeners who are wondering if this clinic is near them, OmniDental is located at 305 E. Rand Road in Arlington Heights, Illinois. But looking at their overall service area, they seem to act as a hub for that whole northwest suburban region.
They do. They list a whole neighborhood of communities they serve. Places like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows,
Stromberg, Wheeling,
Davies, and Elk Grove Village. It's a very accessible location for basically anyone living in that corridor.
And what about the actual vibe of the place? Because dental anxiety is a very real thing for a lot of people. Does this place feel like a cold, sterile hospital?
Not at all. The source material strongly emphasizes a family atmosphere. They explicitly say they treat their patients like family, handling everyone from toddlers getting their first checkup all the way to seniors. So it's specifically designed to be comfortable and welcoming, not overly clinical.
There is another detail about their core philosophy that caught my eye, too. They call themselves an environmentally conscious dental practice.
Yes, that is fairly unique in the industry. They use sustainable practices wherever possible to minimize their environmental impact. And they combine that eco-friendly approach with advanced technology for better accuracy and patient comfort. So it's very high-tech. but with a conscience.
I love that combination. High-tech, sustainable, and they save your teeth. But, and here is where it gets really interesting for me, we haven't even talked about the second half of their name yet.
Ah, yes. Omnidental and MedSpa.
Now, med spa usually implies something very, very different from drilling cavities and doing root canals. Usually when I think of going to the dentist, I don't exactly think spa day.
It does seem like an odd pairing at first glance, I'll admit. But if you actually look at the list of services they offer, it's actually a brilliant synergy.
So, besides the general dentistry and cosmetic things like Invisalign and teeth whitening, what else are they actually doing in there?
It is a surprisingly extensive list. They offer a full range of aesthetic services. We are talking about injectables, things like Botox, dermal fillers, platelet-rich fibrin.
Okay, so a lot of the anti-aging stuff?
Right. But then they have a whole skin treatment menu on top of that.
Hmm.
Microneedling, hydrofacials, laser pigmentation removal.
Wow. It's like a full dermatological spa just hidden inside the dentist's office.
And it goes even further than that. They list permanent makeup services, so microblading and lip blushing. They even list full-body treatments like laser hair removal and body sculpting.
Wait, that is wild. You could literally go in, get a root canal, fix your smile, get a relaxing hydrofacial, and do laser hair removal all at the exact same location.
Theoretically, yes, you could do all of that. But think about the underlying logic here. A dentist is already an absolute expert in the intricate anatomy of the face. They know the musculature of the jaw, the cheeks, and the mouth better than almost anyone else in medicine.
Oh, that's a really great point. They are basically the masters of that specific real estate.
Exactly. So having a highly trained dentist administer your Botox or fillers makes a lot of sense from a safety and a precision standpoint. But also, think about the smile makeover concept they mentioned in the source text.
Go on, how does that connect?
Well, a smile isn't just a set of teeth floating in a void, right? It's framed by your lips, your skin, your entire face. If you spend time and money straightening your teeth with Invisalign, but you're still self-conscious about the frame, maybe your lips or the skin around your mouth, you haven't really completed the makeover.
I see what you mean. It's a much more holistic approach to facial aesthetics.
Right. Omnidental seems to be bridging that gap perfectly. It's also incredibly efficient. If you're already sitting in the chair and numb for a dental procedure, why not take care of the aesthetic enhancements at the exact same time? It stops being just a dreaded dentist appointment and transforms into a comprehensive wellness visit.
It's one-stop shopping for your entire face. I kind of love it. And frankly, if I'm going to be stuck in the chair anyway, I might as well leave looking a little bit better than when I arrived.
It certainly saves you a second trip across town to a completely separate spa.
So, bringing it all back home. We started out with the scary stuff, the dreaded root canal, and we somehow ended up talking about hydrofacials and body sculpting. But let's refocus on that core medical message about the warning signs. Because all the aesthetic skin treatments in the world really don't matter if you're sitting there in agonizing pain.
That is very true. The main takeaway from all of this is urgency. Do not wait. The source actually mentions a 333 rule in their FAQ section regarding symptoms, but the core message for everyone listening is simple. If you have persistent pain, if you have sensitivity that lingers for seconds or minutes, or you see that telltale swelling on the gums, early evaluation is absolutely everything.
Because waiting just lets the bacteria win the battle.
Exactly. Waiting leads directly to the infection, spreading further and potentially losing the tooth entirely. Catching it early saves the tooth. It's really that simple.
So if you are listening to this in the Arlington Heights area and you are nodding along to any of these scary symptoms, or maybe you just want to check out that massive med spa menu, what should you actually do?
You should definitely reach out to Omnidental and MedSpa. Again, they're located at 305 E Rand Road. You can call them directly to set something up. Their phone number is 847-483-8833.
That's 847-483-8833.
And the source material emphasizes that you can easily book online, specifically mentioning that they have appointments available for new patients. So they make it very easy to get that first foot in the door and get evaluated.
Before we wrap up today, I want to leave everyone listening with one final thought to mull over. We spend so much of our lives dreading the dentist, thinking of them as the people who just poke around and find expensive problems. But looking at this deep dive, specifically the mechanics of the root canal procedure, it really changes the whole narrative for me.
It really does reframe it entirely.
We shouldn't just think of dentists as mechanics fixing broken parts. In a very real way, they are conservationists.
That is a beautiful way to put it. Conservationists.
They are there to save a vital living part of your body. That natural tooth has been with you your whole life, and the ultimate goal of Dr. Poles and his entire team is to make sure it stays right there with you, functioning perfectly for years to come. And honestly, that's worth spending a little time in the chair, don't you think?
Absolutely. A saved tooth is a massive medical victory. And knowing these warning signs is the very first step to winning that battle.
Thanks for deep diving into this with us today. Listen to your body, keep an eye out for those signs, especially that linger factor we talked about, and we'll catch you on the next one.
Take care, everyone.